Hello. Good evening, fellow friends and loved ones. It's once again a very great privilege and great honor to come to your homes once again. Yes, it's an honor and a due privilege to bring to you once again a very interesting topic. And once again, want to thank you very much for your time, your consistency with us, even throughout the months past up until now. Yes, you've been consistent with us and we appreciate your time and everything. And so this morning we had the presentation at the St. John's Catholic Church at Udoko, and it was a success by the grace of God. And we had a discussion on pain and posture and its relation to mental health. So how pain and posture relate to mental health. So I want to thank you all for your presence, and to the Catholics, that thank you very much for accepting us to come to your homes. And so today, the 16th of May 2021, and we are come to have a very short but very interesting discussion. And I'm sure we like to share the page too. So if you are watching now, you can share the page onto your Facebook wall for other people also to listen to. Today's topic is actually quite interesting one. The flyers had gone out throughout the week, and I thank you very much for your time this evening. So we're talking about a condition we call jaw pain and its associated disorders. Jaw pain, or scientifically it's called temporomandibular joint dysfunction. I'm sure it's quite a big word, temporomandibular joint dysfunction. And so we'll delve into the meaning of the words, the two words, temporomandibular joint, and then we'll further on talk about the signs, the symptoms, what causes it, and then how the condition is diagnosed, and how we treat this condition called temporomandibular joint dysfunction, or in a plain or in a layman's language, jaw pain and its associated disorders, and then probably some lifestyle modifications to this condition. Okay, so first of all, what is temporomandibular joint? It's actually a big word, but it's quite understandable. When you say temporomandibular, temporal is actually a part of the face where some of the bones are found. So if you look at this part of the face, the upper part of the face, round to this part, we have a bone we call temporal bone. Temporal bone is found around the side. Temporal bone. It's actually a bone that connects your cheeks. The muscles of your cheeks sit on. The temporal bone is actually what your cheekbone sits on. The temporal bone. And mandibular means it's the chin. It's close to the chin. We have the maxilla and the mandibular. Mandibular bone is actually the chin bone, and these are very, very important. These two bones, the temporal bone around the side and the mandibular bone around the side. Some pictures will be shown to you very, very soon. So the temporal bones are located around the side, and mandibular bone is also located around the side. So these bones, you have muscle that sits on them. So you can see in this my cheeks here, yes, and then you can see the mandibular bone here. This is where my chin is, my chin. So when I take off this, when I take off this, when I take off this, my chin, this muscles here, you see the bones very, very visibly here. And if you take off this my cheeks off, you see the bones there. I'll be showing you some pictures very, very, very soon. And so this temporal bone and mandibular bone, when they come together, they form the temporomandibular joint. So I'm sure now you can get it. So a joint is actually an intersection between two bones. So when someone asks you what's a joint is a place where two or more bones meet. And so when these bones come together from this side to the ear region, the chin bone also comes to the ear region. There's a structurally presented position of these two bones where they overlap. So this bone, if this is the mandibular bone, temporal bone and mandibular bone, they come this way, and there's a small space in between them where they don't come into contact, because when the bones come into contact, they begin to wear against each other. And when two bones come and wear against each other, they cause pain. And so God has made it very, very, very grateful. In fact, very, very, very wonderfully constructed, such that the bones don't come together and have too much contact. So he has made something we call a cartilage, an articular cartilage or a disc. So this disc is found in between the bones, and so when they are found in between the bones, they prevent them from coming into contact with each other. So the pictures will be shown to you very, very soon. So the picture, the disc doesn't allow the bones to come together into contact. So then you're able to chew, you're able to laugh, you're able to shout, and so many things. You're able to smile without the bones coming together. But in the case where we are growing older or we overuse this structure we call the cheekbone and then the chin bone, we can have this disc wearing away. And when the disc around the side is wearing away, it could cause temporomandibular joint dysfunction. Okay, so we've talked about the anatomy. I'm sure we'll be seeing some pictures very soon about the bone. And then one anatomy that we have structures we call muscles around the face. These my cheeks are all muscles. These are all muscles. My cheek muscles are very important. Without my cheek muscles, I can't move. The bone will just be there. The bone doesn't move. Actually, one thing you have to understand that the bone doesn't move. The bone is structure is very static. But because of the presence of muscles, you can open your mouth, you can smile, you can see I'm smiling, and my bones are moving. I'm talking and my bones are moving. Without my muscles, my bones will be immovable. So in this case, the cheekbone is around the side, the temporal bone, the mandibular bone is around the side. So when they come into contact with each other, the disc, the intervertebral disc, that's the disc here, which will be shown to you very, very soon, they prevent them from coming together. So some of the muscles around the face, we have the masseter muscle that helps with chewing. We have the rhizorus muscle that helps you to smile. We have the zygomaticus major, zygomaticus minor. We have the orbicularis oris, orbicularis oculi, that's our cheek, the one that helps us to smile. Orbicularis oris, the one that helps us to see or close your eyes. And then we have frontalis, we have temporalis, so many muscles in the face. And so, but the ones we are talking about today are two muscles. We have the masseter muscles, the one that helps us with chewing. So in the case where we have injury to this muscle called the masseter muscle, it could also affect the joint placement around the side. We spoke about the fact that we have the disc around the side. So in case the muscle is injured, it could affect the position of the joint. So if you have dislocation of the bone, you could have temporomandibular joint dysfunction. But before we can confirm, we have other special tests and other clinical tests that we do before we can conclude or diagnose this condition. Okay, so actually this condition called the temporomandibular joint dysfunction, actually it has three main subcategories. When you say subcategories, we have different classification. So first of all, you can have just pain in your face, maybe pain around the side of your cheeks, which we can say you might have this condition called temporomandibular joint dysfunction, just pain. And also there could be also dislocation. So maybe you are fighting like a boxer fighting, and he's fighting like this, and they blow his cheekbone and he falls down and loses the battle. When he goes to the hospital, they can check if his joint is in place, if the bone has shifted. The physiotherapist or the doctor could diagnose his condition as temporomandibular joint dysfunction. We'll show you some of the presentation of what we're talking about, where we have pain, where we have dislocation, and also the third one is where we have degeneration. That is the bones coming together and then the disc wearing away, where we have a condition we call arthritis. You have arthritis, you have osteoarthritis, we have rheumatoid arthritis, and all arthritis co-presents with pain around the jaw region. And if you have pain around the joint region, you could have this condition called temporomandibular joint dysfunction. Okay, so this is instances where we can diagnose you as having temporomandibular joint dysfunction. The first one is pain around the joint, and then 2, dislocation, where we have the shifting of the jaw as a result of trauma or an accident to the jawbone area, and then we can have arthritis. Okay, so what causes it? I've mentioned some of the causes of the temporomandibular joint dysfunction, or the chick, or the jaw pain and associated disorders. Okay, so one is trauma. So as you mentioned, someone can just you can just be there, and then someone will just be playing with you and blow your jawbone like this, like this. It could have a dislocation to your jaw, and you could have pain, or maybe they could have even a muscle tear. We have muscles around the jaw, which we'll be showing very soon. I've mentioned some of the muscles. We have ligaments around the jaw. At a point where a bone meets a bone, we have a structure we call the ligament. Let's not forget a ligament. A ligament are structures that connect bone to bone, and they help the bone to stay in place. The muscles help the bone to move, but the ligament supports the muscles in order to prevent dislocation. So we have ligaments there, and so when someone can blow you, the bone might not shift, but when the ligaments are torn, we have grades of ligament tear, which I'm sure if I start talking about it, we'll finish now. But we have grades of ligament tears. We have grade 1, grade 2, grade 3. Yes, about 5 grades of ligament tears. And so when you have even grade 1, that is small tear, you could have presenting complaints of pain. And so when you can carry out so many tests, and we might not see any dislocation, we might not see any fracture of the bone, but then through our other tests such as palpation, such as special tests, we can see that, oh, there's a ligament tear, then we treat it. Okay, so we can have a trauma, we could have infection. So if you have infection around your jawbone, your jaw area, we can run tests also. The doctor or the dentist can run a test to see whether there's an infection around the side. If there's infection, you can present with jaw pain. And so if you have jaw pain, you just don't see that, oh, someone has blown you, so I have jaw pain, I'm going to treat it, I'm going to take medication by myself. So you need to see the specialist, you see a dentist or a physiotherapist or the medical doctor, so that we can assess you and then see what actually the presenting complaint is, or what actually the condition is. Okay, so we've talked about the causes, but now what are some of the signs and symptoms of someone having a jaw pain? Actually, the pain can be at the jaw region, just like that. You'll be feeling pain at jaw region. Also, the pain can come from the face. It can come from some headaches that goes round to your jaw region. There also can be pain from your neck. So we can have neck pain that comes round to your jaw region. That is we call a radiating pain. Also, you can have muscle stiffness. So if you have stiffness around the jaw area, they could have presenting complaints of pain in your jaw, or we can diagnose you as temporomandibular joint dysfunction. And also, if you have limited movement in your jaw, that's when you're trying to open your jaw, like you have limited movement, you can't open it up, or you even hear sometimes you hear sounds in your jaw, or you hear crackling sounds with pain. So in instances, there are some instances where you have opening of your jaw and you hear some popping sound with pain. Some people actually have this when they crack their teeth, or the teeth grind each other, they don't feel pain, but then they could feel pain at quite a longer time. So when you hear someone chewing his teeth, like grinding his teeth without pain, it wouldn't necessarily mean that the person has temporomandibular joint dysfunction, or grinding teeth like continuously. It doesn't mean the person has temporomandibular joint dysfunction, but then it could infer that in the longer term, the person could have the bones wearing or getting close to each other and could have pain. And also a change in the way the upper and joint teeth fit together. So if you have probably someone who has his teeth overgrowing, yes, there could be instances where there could be change in positions of the jaw bone, and so the person could have temporomandibular joint dysfunction. These are all factors, but then we check all and we test all to make sure that yes, one is being prominent, or other factors are being considered, such as if the person has infection, we take tests to see whether the place is infected. That is mostly done by the dentist to be able to conclude that the person has a temporomandibular joint dysfunction. Okay, so how is this condition diagnosed? So if someone comes to the hospital and says that, oh, I have joint pain, what do we do as medical practitioners? So there are instances where the dentist has a special type of x-ray, so they take the x-ray of the teeth and they could see whether the joint space has been reduced around the joint area. If it's reduced, then we can narrow it to having temporomandibular joint dysfunction. If it's not reduced and there's infection, we could check. They have their own special test they do to be able to see whether it's infected, and then they treat them accordingly. So the history of the condition is very, very, very important for the medical practitioner, the therapist, or the dentist or the medical doctor to be able to diagnose. Okay, so as you've learned about the causes, the signs and symptoms, and then the structures around the side, we'll now look at how to treat this condition. So there are so many ways of treating this condition. Actually, in the case where it's acute, that is the first point or the first day you feel the pain, to about 3 weeks, we say the condition is acute. So between 3 weeks to about 6 months, the condition is subacute. After 6 months going to 8 months, 1 year, the condition is termed chronic. So we have acute, subacute, and chronic pain. So the initial instance is that when someone has an acute pain, the person uses ice. So you get ice block, you get around the jaw area. If you have pain around your neck, so you move around your jaw area to your neck region. As often as probably you can do it every hour or every 2 hours, you get the ice block and moves around your jaw area. So this helps to relieve pain and also to close up the blood vessels around the side, and this helps also to improve healing and also thus improve function. Okay, so these are some of the self-care practices that you have to do if you have jaw pain. So it's advised that you eat soft foods, so you shouldn't chew bones and shouldn't chew hard nuts like tiger nuts and other hard struts like this thing. There's a I've forgotten the name. There's one of this, I've forgotten, but we call it in Ghana we call it agbe toffee. It's actually a toffee that is very hard. When you break it down, in fact, even take you even break your teeth. Yeah, so if you have jaw pain, you should avoid chewing hard substances. Okay, and also you need to apply ice if you have jaw pain. That's the first instance. Apply ice, and also you have to avoid extreme movements in the jaw. So try not to open your mouth very wide. You also try not to sing aloud. Some people, when you sing aloud, so this means that singers who sing aloud have a predisposing factor of having this condition. Yes, so if you're a singer, you will advise you that you shouldn't sing aloud, because if you sing aloud for a long time, you could have this condition we call temporomandibular joint dysfunction. Just as a footballer runs and plays football with the legs and can have knee injury, can have ankle injury, as a singer too, this is a condition that you can have. You can have temporomandibular joint dysfunction. So as singers, we should minimize shouting and singing. We can sing from our belly. So we advise singers that they should sing from their belly and avoid singing aloud like yeah. This continuously could cause wearing away of the joint called temporomandibular joint. And also we also learn to do relaxation techniques. That is, we try and breathe in and also try and move our joints gradually, slowly, and this helps also to strengthen the jaw. So aside these modifications or these preventive measures, when the pain becomes overwhelming or becomes extreme, at the first instance we prescribe medications such as pain medication. So a physiotherapist has limitations in medications. We are limited to just pain medication. Even some of the pain medications are very limited. We don't prescribe medications. We resort to other non-orthodox medications. So we have the ice, we have the hot pack, we have we have TENS machine, we have shockwave machine, we have shortwave machine. These are some of the machine that we use on patients with pain. We have ultrasound, so we can use ultrasound around the jaw. But as increasing pain presents itself, we sought to giving NSAID. When we say NSAID, yeah, medication that helps to reduce inflammation or reduce the pain around the joints. That one is prescribed by the medical doctor. And also we have the points where we use stabilization splint. So actually this is prescribed by the dentist. So we have a device we call stabilization splint, and this helps to stabilize the jaw and prevents the pain from becoming excessive, becoming too much. There's an injection we call the Botox drug, but this has not been fully researched by doctors, and so research is still being carried out to be able to see the efficacy of this medication. Aside that, we when everything is sought or everything has been tried, we've tried preventive measures, we've tried therapy, we've tried rest, we've tried ice, so many things, and it doesn't work. Then now the surgeon comes into place, because we need to be able to ensure that the person becomes functional, be able to carry out his activities of daily living very effectively. So surgery comes into place. We have implants, so you can get an implant into the temporomandibular joint, and this helps also to allow movement in the jaw region. You have implants, and these are very, very important. Okay, so aside the surgery, we also have the instant after the surgery. We can have various gentle exercises to ensure that there's less pain and also there's very good function. And also we do counsel. So we counsel patients that yes, despite the fact that the surgery has been done, it doesn't give them the leeway to misuse their jawbone, because there could be function or there could be pain in the joint. So we advise the patients to take care of themselves very well, and also avoid contact too much around the jawbone. Okay, so there are exercises that also, as physiotherapists, we teach patients who come to the unit or to the hospital to reduce pain in the joint. So we can look at some pictures now. I'm sure now we're ready to look at some pictures. Okay, so just a minute. Ooh, just a minute. Okay. So yes, so you can see the jawbone now. So this is the temporomandibular joint. You can see it here. Yes, so this is the jawbone. We have the temporomandibular joint. So this is it. So this is the joint here. It's called a temporomandibular joint. So this bone coming here is called the mandibular bone, and this from here to this region is called the temporal bone. So at the point of intersection or the meeting point of these two bones, the temporal bone and then the mandibular bone, is called the temporomandibular joint. So this is the thickened area, the orange area is called the temporomandibular joint. Temporomandibular joint. Okay, so the structure inside is called the intervertebral disc, and has articular cartilage also to prevent the bones from coming together and wearing away. So this is the normal joint. You can see this is a normal joint, and this is an abnormal joint or dislocated joint. You can see the disc here in its normal position, and you can see a disc here shifted from its normal position. So there'll be an instance where the bones might come to contact with each other, and then they could have pain, and then can be diagnosed as temporomandibular joint dysfunction. And also we can have an abnormal joint here. This is, you can see the bone here wearing away. Yes, it could be as a result of arthritis. So we mentioned arthritis also. That's the bones wearing away. That is degeneration of the bone. So I'm sure you can see that. So this is also a picture showing how the condition presents itself. You can have chronic pain, discomfort around the joint area. You can have discomfort from the shoulders to the neck and head, chronic headaches. You can have popping of the joints with pain, and the joints also can lock when you open your mouth and when you close your mouth. Okay, so this is anatomy of the side of your face. So this is the masseter muscle. This muscle is called masseter muscle. This is called the disc, the intervertebral disc, and this is called the temporal muscle. Temporal muscle. Okay. So this is the facial muscles. So I mentioned here the facial muscles. We have the teeth here, we have the mouth, we have the throat. These are all muscles. And if you have temporomandibular joint dysfunction, you could have headache, you could have pain, head pain, you could have your you could have pain around the joint region. Yes. And you could have ear problem too, because the jaw bone is actually connected around the ear region. So you could have present complaints of ear pain. Ear pain. Yes, you can see this anatomy of the temporomandibular joints too. You can see it very, very clearly now. So this is the temporomandibular joints, the ear canal. So this is a temporal bone. You can see it's labeled here, the temporal bone. So the cheek bone, the cheek muscles are located around the temporal muscle, the temporal bone. You can see it here. Yes, so this is the facial muscles. Okay, so this is another one too. This is the mandible. Remember I mentioned the mandibular bone. This is the mandible, and this is the temporal bone. You can see it here now. I'm sure you can see that I'm not lying now. This is the disc here. Okay, so this is another one too. The red sign indicates pain. You can see the pain. You can see it here. This is the articular disc or articular cartilage. You can see it labeled here. The articular is here, articular disc or articular cartilage, and this structure around it, this whole thing is called the mandible, but near to the articular disc is called the condyle. Okay, so let's look at more pictures. These are some of the symptoms that the patient can bring or complain about. Okay. So this anatomy of the structure here too. You can see here you have other muscles around the cheek region. You have the pterygoid muscle. These are all lateral pterygoid. That is responsible for the opening of the mouth and closing of the mouth too. So this is the articular disc here. You can see it here, preventing these two bones from coming together and then wearing away. Okay. So this is the anatomy. You can see it here. Okay. So we'll be zooming into some exercises very soon that you can do. Okay, so this a very good exercise program as physiotherapists we take you through. That the first one is where you push your neck inside. So you push your head inside, and then also this one, so you open your mouth up and down, up and down, up and down. Okay, and then this one to the second one, the third one is you open your mouth wide, open your mouth wide. So these are some of the three exercises that as physiotherapists we go through if we have pain in your jaw or the temporomandibular joint dysfunction. Okay. So aside that, these are some of the exercises to you could hold your. The first one is you put two hands, your two fingers to your jaw region, and then you turn your jaw to the side. Okay. So this all helps to relieve pain. And the second one is you put your hands across to the back, I mean to the front part of your ears, and then open up your mouth very, very wide. And this helps to relieve pain and to stretch and do a gentle stretch around the joints region. So these are some of the exercises that we do. Yeah, so the first one is you just close your mouth a little bit harder. And this one, the second one is you raise your tongue to touch the top part of your the roof of your tongue of your mouth, so the up. And then the other one is you just hold you can see it here, this one. Just put your hands close to your cheeks and then you try to massage your cheeks a little. And this one, you just push your chin into your neck and hold it for some time. This one, so you try and push your jaw forward. So these are some exercises that you can do when you have jaw pain. So some things that we avoid when you have jaw pain is you avoid chewing gum. If you have jaw pain, you also try not to eat hard foods such as chewing bones, and try not to put your chin on the table. And also the other one is you try avoid chewing your fingernails. If you chew your fingernails, you also avoid bending to pick things or to pick objects from the ground or from a height. This is some exercise that you also do. That is, you put your tongue to the upper part of your mouth and open up. Okay. Another one. These are the anatomy of the face. Okay. So some of the causes of temporomandibular joint dysfunction or the joint pain or the jaw pain is trauma. That's when someone beats you or someone hits your jaw. Okay. So do you have some exercises? Let me check whether we can. I think we have some few exercises more. Okay, I think that is it. See, yep. Okay. So you can see we've learned a lot today. So just a minute. Okay. Yes. So we've learned a lot. I'm very grateful that we spent time. We've learned a lot from today's discussion. We said we wouldn't keep long, but it looked like this discussion was very interesting, especially with the pictures that came up. Yes, I'm sure. At least we know that temporomandibular joint actually is located around the side. So if anyone asks you what you learned today, I'm sure you go to answer. So thank you very much for your time. I'm very grateful. Today is the 16th of May 2021, and today we talked about jaw pain and associated disorders or problems. And so this brings us to the end of today's presentation. And next week we'll be talking about a very interesting topic also. Yes, and I know you don't like to miss this topic. It's actually a very important topic in our health setting, and it's called lymph edema. Okay, so we'll see you next week as we talk about this condition. Have a blessed evening. Thank you for staying to the end, and may the good Lord be with us all. Have a wonderful week. Stay blessed and take care. Okay, so let me acknowledge those who joined us before we cut. I saw Ruth, Stephen, Mr. Daniel, Haruna, Bernard, and others also coming to join. Thank you very much, and Stephen. Yes, we thank God for the opportunity. Okay, thank you very much to Mr. Dudu. Yes, have a blessed evening. Have a wonderful week. And stay tuned. See you next week. Bye bye.